Okay, good morning, everyone. We're back this morning to talk again about this fascinating topic of the use of tissue chips for environmental health studies. And now we're going to switch gears. Oh, there it goes. Now we're going to switch gears and actually talk about how are we going to apply this in particular. What is the regulatory perspective from a number of agencies on how these various techniques might be used? So next slide, please. Just want to show that this is a slide from Yvonne from yesterday. Here we are on the adverse outcome pathway. It appears that the tissue organ chip methodologies are fitting in kind of that middle gap between the in vitro high throughput methods and the actual animal studies, in-life studies, and hopefully can also eventually reach the point, I guess is the hope, where they can start replacing more of the need for the right side of that continuum of testing. So today I'd like to invite to our panel here, we have four very experienced regulatory individuals we're very fortunate to get these folks from four different agencies. We have John Bucher from the National Toxicology Program, NIEHS, Wei-Shui Chu from Environmental, next slide, please. Next slide. I'm going to skip over that for now. Wei-Shui Chu from the U.S. Environmental Protection Agency, Danilo Tagli from the National Center for Advancing Translational Sciences, National Institutes of Health, and Frank Weischel, I hope I pronounced that right, U.S. Food and Drug Administration. So if you're present in the audience, please take a seat at the table. Oh, thank you. Just a little slow on the uptake this morning. Put our little sign here that doesn't want to stay up. Are we missing a Frank? Is Frank here? Not here this morning? Okay, well, I'm sure he'll join us when he can. So this morning there are two charge questions, or two discussion questions. Next slide, please. Oh, I'm sorry, I can do this, if I can figure this out. Which are rather long. But they are the first one is, from what you have heard, would data from tissue chip technologies combined with more high throughput testing give you more confidence in screening and prioritizing chemicals for further assessment? And two, to what extent could you use data from these platforms in risk assessment context? Do they appear to have potential to validate mode of action, support qualitative risk assessment, reduce the range of uncertainty, or other steps within federal risk assessment processes? So thank you very much for being willing to let us put you on the spot on this new technology. And I guess if you'd like to just go from left to right and maybe give a few comments on your perspective, either on these questions or anything else you've heard yesterday that would apply to the use of these methodologies in risk assessment and regulation. And then we'll open it up to question, answer, and discussion.